Hi guys, welcome back to our channel, Your Neighborhood Nurse. Today we are going to continue our series on mental health problems for adults. Have you checked out the first video we did on mental health series? If you haven't, please check that out. So we're starting off today with this NCLEX question. When planning the discharge of a client with chronic anxiety, which is the most appropriate maintenance goal? A says suppressing feeling of anxiety. B says identifying anxiety producing situations. C says continuing contact with a crisis counselor. And D says eliminating all anxiety from daily situation. Go ahead and pause this video and try out to see if you get the answer. The answer is B. Recognizing situations that produce anxiety allows the client to prepare to cope with anxiety or avoid specific stimulus, which is true, going to the root cause of that problem rather than suppressing it. Okay. B says counselors will not be available for all anxiety producing situations, and these options encourage patients to develop their internal strength. Yes, the counselor is there to help the patient to identify the root cause of the problem. And then also the patient would learn how to help themselves, gain internal strength. Suppressing feelings will not resolve anxiety. Yes, rather it will compound things and it will make getting well difficult for the patient. Eliminating all anxiety from life is impossible. Yes. So I'm going to teach you one NCLEX trick here. Anytime you see an option having the close-ended word like all, just know that is not and that will not be the answer because for example, in this situation, the patient is still alive. So there's no way the patient will not have situations that would threaten their peace or make them feel anxious. Okay. So let's continue. Today we are going to be looking at series number 2, which is generalized anxiety. Now, what is generalized anxiety? This type of anxiety is an unrealistic anxiety about everyday worries, normal things the patient feels anxious about it. Now, how do you know that the patient has generalized anxiety? This You would know if this anxious situation or this situation has extended to at least 6 months and is not associated with any mental or medical problem. Okay. And here you also see symptoms occurring too. Okay. So let's talk about assessment. How do we assess a patient with generalized anxiety? First, the patient will be experiencing restlessness and inability to relax. The patient will be dizzy, trembling and shaking, cannot concentrate. The patient cannot connect between anxiety and the physical symptoms they experience, and chronic fatigue and sleep problem. What are the nursing intervention in this case? The first thing the nurse has to think about will be safety. The second will be providing comfort for the patient. And the third will be refocusing the patient's attention and concentration. Okay. Now, so let's talk about unexpected and expected panic attack. Here, the patient would have extreme level of anxiety resulting in distorted behavior, severe recurrent intermittent anxiety attack that can last from 5 to 30 minutes when it occurs. When this attack happens, it produces sudden onset of dread and intense apprehension. So the patient the patient has the feeling of impending doom. What are the assessments? What are the things we can see in patients that are experiencing unexpected or expected panic attack? Here we will see changes in vital signs like increased heart rate, chest pains, dizziness, blurry vision, numbness and tingling in the extremity, choking sensation, even the feeling of dying and being trapped, a sense of unreality and helplessness. What is the nursing intervention here? Remember, safety first. We have to remain with the client. Secondly, we have to use cognitive restructuring. What does it mean? It means that the nurse would have to help the patient to replace his or her distorted thinking to the right thing. Okay, assist the client to identify the thoughts that cause this anxiety, the root cause of this anxiety, and the basis of this anxiety. Attend to the physical symptoms. Assist the client to change unrealistic thought to more realistic thoughts. And here, we can help the patient by administering anti-anxiety medication as prescribed by the PHCP. Next, we'll be talking about PTSD, which is post-traumatic stress disorder. Clients, after experiencing a psychological traumatic event, they are prone to having to re-experience that event again. They have recurrent intrusive dreams or flashbacks of that event that had happened, the traumatic event that had happened to them before. So this, how do we diagnose PTSD? The symptoms can last up to 1 month and can occur months to years after the traumatizing event that the patient had. What are the stressors? What are the things that can lead to PTSD? Natural disasters can lead to PTSD. Terrorist attack, accidents, rape, sexual or physical or emotional abuse, and also um, accidents can lead to can lead to PTSD. Now, assessment: the patient would feel detached, anxious all the time, avoidance of numbness, irritability, outburst of anger, flashbacks of the event. They can even feel depressed and suicidal. Here, our nursing intervention here is to be non-judgmental and supportive. Also reassure the client that their feeling and behavior is normal. They can feel normal. What they are experiencing is normal. Assist the client to recognize, associate between what they are feeling and provide therapy that addresses the loss or anger issues. Monitor suicidal risks. This is very important. And teach stress management techniques, like breathing techniques, like distraction techniques, restructuring techniques, and so on. Now, in order to continue, we can also encourage the patients to join support groups. They can develop adaptive coping mechanism. They can have their own relaxation techniques. Families too. Families of patients with PTSD, they also need treatment as well. Okay. And we can also use flooding, reviewing the traumatic experience, helping the patient gradually go through that process and talk about the experience too. Note: clients with cancer may develop post traumatic stress, and post traumatic stress can occur maybe during or after treatment. Post traumatic stress has similar symptoms like PTSD, but it's not severe. So we um, should keep that in mind for clients who have cancer. All right, guys. So